Hello everybody, I am Dr. Usha Nandini, fetal medicine specialist with special interest in fetal cardiology, and I work for Tiny Hearts Tanjavur, which is in South India in Tamil Nadu. Today we are going to talk about congenital heart defects. What is a congenital heart defect? Congenital heart defect is a problem which happens in a baby when the baby is still in the mother's womb, which means we all know that heart is a vital organ for all of us to live. So the formation of heart begins when the baby is still in the mother's womb, and most of it gets completed by the end of 12 weeks, which means around 3 months of life. Most of us do not know that congenital heart defect is one of the commonest problems which can happen to a baby, and usually it is being recognized only after birth. And the incidence of this condition is, if 100 women are pregnant, approximately 2 to 3 of them are likely to carry a baby with congenital heart problem. And I am here to say that every pregnant woman should undergo a fetal echocardiogram to pick this as early as possible, so that we are here to help and guide the parents and treat the babies. Healthy children are going to form the healthy society. So let us join hands together to treat all these babies. How is a congenital heart defect usually being diagnosed in a baby? What happens usually is, a child is born, and then when there is anything abnormal being noted in the baby, then the baby is subjected to an echocardiogram and a heart condition is diagnosed. Sometimes major heart problems or complex congenital heart defects could present very severely after birth, and by the time it might be too late to intervene, and sometimes we end up losing those babies. Hence, I am going to tell if this can be diagnosed even when the baby is in the mother's womb. That's called a fetal echocardiogram. What is a fetus? A fetus is the baby in the mother's womb, and by doing fetal echocardiogram, we will be able to detect this kind of congenital heart problem. Who should get a fetal echocardiogram done? I would say every pregnant mother should be subjected to have a fetal echocardiogram at least once during the pregnancy, around 5th month of the pregnancy, so that if there is any major problems, it will be certainly be identified at that point in time, which will help us to counsel the parents and make them prepared emotionally, financially, and by all means to make the expecting parents understand the severity of the disease. There is a myth and a panic when we say that a baby has a heart problem. So, should we really worry about it? The answer is a big no, because most of the heart problems are treatable, or I would say all the congenital birth defects are treatable. In fact, not all of them are major. We can classify them as simple problems, simple CHDs, minor cardiac problems, or major and complex cardiac problems. Based on the abnormality, the baby might require medications or interventions or surgeries. Of course, identification is the first step, and after this is done, the couple or the pregnant woman should definitely go and approach a pediatric cardiologist or a fetal cardiologist who gives us the detailed information about the cardiac condition and also talks about the further treatment plans and options. One another thing we must remember, after a baby is being diagnosed to have a congenital heart defect in the fetal echocardiogram, is to look for other possible abnormalities which could be not related to the heart or could be related to any chromosomal or genetic problems. And how can this be done? This can be done by a fetal medicine expert, and then if required, she will do a testing which also confirms the normalcy of the other system as well as the chromosomes of the baby, which makes it easy for the baby to proceed for further treatment after birth. Again, I emphasize the need for fetal echocardiogram so that we can pick up all the congenital heart defects in a fetal echocardiogram, and most of them are treatable, and these children too can have healthy life and good future. Healthy children are going to form the healthy society. Indeed, today's children are going to be tomorrow's nation builders. So we all should join together to create this awareness amongst public that all these children too can have a good future, and when picked up at appropriate time, all these conditions are treatable. We doctors are here to help all these children and their families. Thank you very much.